This is Dr. Rob Harder with the Nonprofit Leadership Podcast, Making Your World Better. What does it take to be an effective nonprofit leader today? What are the biggest challenges? What are the biggest obstacles? How should nonprofits fundraise in an economy that is constantly changing? All of these reasons combined led me to start this show. And it's my hope that through this series, people can learn not only what it takes to be an effective nonprofit organization, but to hear from effective leaders who are successfully making a positive impact in their communities. We hope you enjoy the show as together we hear how they are making their world better. Welcome to the Nonprofit Leadership Podcast, Making Your World Better. Thanks so much for tuning in. Always good to have you along with us. We've got a very fascinating guest again today, and we're going to talk about a lot of different things and specifically focusing on medical research. But part of the conversation we end up having is the impact of AI. And you know, I've had many guests on the show talking about AI. How can AI be used for good for your nonprofit? How much AI should we use? And what are the dangers of using AI? All those kinds of topics. Well, she's dealing with this as well, and a little bit different application when it comes to medical research. And my guest again today is Dr. Kristen Brown, and she's with the Urban Institute. And among many things, we're going to talk about what she's doing. She's doing a lot of research focusing on maternal health here in the United States. But then we end up talking about AI. And what is the net gain for using AI? Is it net positive or is it a net negative? And so it's going to be interesting to hear her response to this when I ask that question of her. Well, as always, thanks so much for tuning in. Now on to the show. This podcast is sponsored by DonorBox. DonorBox, helping you help others with the best donation forms in the business. Well, welcome to the Nonprofit Leadership Podcast. We have Dr. Kristen Brown. Doctor, thank you so much for taking time to be on the show today.
Oh, thank you so much for having me. It's just a joy to be here today.
Yeah, well, I always love introducing my listeners to great leaders just like yourself. And so I'm really excited to dive in a bit about what you do at the Urban Institute. So maybe that's always a good way, I feel like, to start out. Give a bit of your background, a bit of your journey. Could you tell me about your path to the Urban Institute and maybe what led up to that?
Sure. So I describe my career as a journey upstream is what I call it. In college, I double majored in biology and psychology. I wanted to understand racial health disparities. And when I came out of college, I was going to grad school. I was like, okay, but I want to be more of a biomedical scientist or more of a social scientist. I thought I had to pick one. And I actually first picked being a biomedical scientist. I was like, okay, I'm going to understand the biology, the physiology behind all of these diseases that we know have a lot of racial health disparities. So I was looking at genes and proteins and things like that. And I was like, wait a minute, this feels a little far off from what I intended to do. So how do I think more about like these social factors? Fortunately, I went to the University of Michigan for grad school, and there in the School of Public Health was a Center for Integrative Approaches to Health Disparities. And there were a social epidemiologist named Ana Diaz-Roux, a genetic epidemiologist named Sharon Cardia, who was trying to understand how our social factors actually affect our bodies and therefore our health and health outcomes. So I started working with them, started studying under them. And that's what I did for a lot of my dissertation work and then again in my postdoc. And then after that, I went to NIH. And the work I was doing at NIH was around risk scores and what goes into these risk scores and what variables are going into these risk scores. And then if we create these risk scores off of mostly white populations, how generalizable are they to other populations? And is the way that we're doing this science actually creating the inequities? So that was a lot of work I was doing at NIH. And then, I'm trained as an epidemiologist. My PhD is in epidemiology, and the pandemic happens, right? So I was like, oh, wait, I'm an epidemiologist. Pandemic is happening. I think I should probably do something around the racial inequities of the pandemic. And Urban had a big project where they were supporting community organizations who were doing the on-the-ground work around education, around vaccines, and trying to get these organizations evidence-based research that they could use in their work. So I came to Urban at first really to join on that project, but also let me extend my work into thinking about policy and how policy is affecting all of these downstream factors. So as I started all the way down in like genes, as downstream as you could possibly get, to go all the way upstream, career stage by career stage to get to policy. Now I can speak to each level and try to think about how each of those levels are affecting health and racial health disparities. So that was my journey to Urban. Enjoy being here so far.
What a great journey. No, thanks for sharing all of that. Okay, so let's talk about your role specifically now. What is it focused on? How has it grown? And how have you developed since you've been there at Urban?
Sure. So I'm a senior research associate at Urban, which means that I manage different projects, mostly around racial health inequities and policy. So I've been able to extend and doing more work in policy now and trying to think about how those factors or those where those leverage points are that we can make in our society to reduce inequities.
Yeah. And I understand the team was recently named as one of the inaugural grantees of the GE Healthcare Foundation, focusing on maternal health specifically. And so, first of all, congratulations. That's a big deal. I know it's a tough vetting process. So well done. Could you give us some context to that? Tell us about the current crisis for moms and babies in the US, and what are you trying to do to address that?
So, first of all, it is such an honor to be named as one of the inaugural grantees for the GE Healthcare Foundation. There's such great synergy. We're aligned in trying to make this a more equitable society. So we're just so honored, one, to even just be supported by the GE Healthcare Foundation. As for maternal health, the US just fares substantially worse than all of our peer countries. I mean, we're talking about Australia, Canada, France, Germany, United Kingdom, Switzerland, Sweden, Norway. The whole list of our peer high income countries, our maternal health rates are just way worse. And so it makes you ask the question, well, why is that? Like, what is it that is going on in how we do healthcare in our healthcare system that we're not getting the outcomes that we should get, right? And it's not just the money issue because we actually spend a lot of money in healthcare and we're not really getting the outcomes that it seems that we should get for how much money we spend in it. So these rates are particularly egregious for Black women. Rates are 2 to 4 times higher for Black women compared to white, Hispanic, or Asian women in terms of maternal mortality in the US, which makes us ask the question, like, well, what are these social factors that are causing these racial inequities? But then, even if you look specifically at the rates for white women, Hispanic women, or Asian women, they are still higher, even within those racial ethnic groups. They're even still higher than the other peer income countries themselves. So it's women overall that are just not having great outcomes here in getting healthcare in the US. We see similar things for infant mortality. We have higher infant mortality rates. So that's when the baby dies before its first birthday, his or her first birthday. And again, we see racial disparities there. And then even if we don't look at mortality, we take a step above and look at morbidity, who's getting sick first before you die, that has an effect on a lot of people in the US as well, where we are getting these unexpected outcomes from labor and delivery that have health impacts over time. And what the really egregious and really problematic part about all of this is that most of this is really preventable, right? Like, because if we're not getting the same outcomes as other similar countries, then this is something about our healthcare system that is producing these abysmal rates. So what is it? There's a few things, policy things. One is the paid leave, right? Other countries guarantee paid leave for mothers after they leave, whereas we send our women back to work too soon. And then before they have had full time to recover physiologically, psychologically from producing a child. Second, other ones have more OBGYNs and more midwives, so we don't have enough in our workforce. Other countries do home visits after the child is born to see how, the child is doing, the mother is doing. And then we also just have our huge insurance coverage issues here, where the other countries have universal health care and we don't, right? So that means that we have a lot of reproductive age women as part of our American society that are uninsured. So that affects them prenatal care and all of the outcomes that we see.
Interesting. Okay. Well, this is so interesting to get more of this context on it. And you've got this research project I know that you're putting a lot of time into. Maybe you can give a little bit more specifics on that, of what it's focused on and what do you hope to have as the outcomes?
So the use of artificial intelligence is everywhere these days, right? And
yes, it is. Yeah.
Everywhere in every sector of society, including in the healthcare of pregnant patients. So, for example, AI is being used to categorize patients as high risk. So, for example, we can identify risk of preeclampsia, of hemorrhaging after childbirth. and then mark those patients that are high risk to give them higher level services to help them address or manage that risk. So the project is really centered around understanding how Medicaid agencies are thinking about their policies about incorporating these AI systems into their healthcare decision-making processes. So our project is really important because Medicaid pays for 41% of births nationwide. So getting this right really has a very broad implications for maternal health.
Interesting. There's so many areas to focus on. And I'm sure when it comes to maternal health for you and your team, you probably had to decide what area you're going to focus specifically within maternal health. When it comes to this project then, and the way you're going about it and the approach you're taking, how did that process go? Bring us into that.
Sure. So we have two components. First, we are trying to see what documentation is publicly available, and then how the Medicaid agencies are incorporating AI into healthcare. So we're first working to build a public knowledge base of Medicaid policies and practices towards using AI in the context of maternal health care. So we have our data science team who's working through a process known as web scraping, where they're collecting information from various state Medicaid websites. And the team is looking through managed care contracts, through state health equity plans, through quality strategies. And this is a large amount of data, a large amount of unstructured data. So they're able to glean information from all of these websites so that we can then make sense of it for policymakers and other stakeholders, community organizers, et cetera. And then from that, our qualitative research team is going to use the findings from the data science team to interview representatives from Medicaid organizations and really just get a sense of what are they thinking around these maternal health factors. So we're going to think about what did they think about when they were trying to develop their equity plans? How well are their equity plans playing out in practice? What are the lessons that they've learned en route to developing their equity plans?
We'll be right back. Are you looking for an easy and effective way to boost your nonprofit's donations? Look no further than DonorBox, the online fundraising platform that streamlines your fundraising efforts, maximizes donations, and simplifies giving for your supporters. With DonorBox, you can create beautiful donation forms, accept digital wallet payments, track donations, and send auto receipts. And the best part? There are no setup or monthly fees and no long-term contracts required. So what are you waiting for? Visit donorbox.org today to get started. That is donorbox.org. Hey friends, thanks so much for listening to the Nonprofit Leadership Podcast. Many of you know that I provide leadership and life coaching. With my 30 years of nonprofit experience, I know firsthand how hard leaders like you work. I also know how important it is to have someone you can call on and to get help with the barriers and leadership challenges you will face both professionally and personally. I really want to help people thrive and become all they were meant to become by providing coaching and consulting services. And it's been so much fun working as a coach, working with clients who are leaders just like you, looking to grow personally and professionally. What you may not know is that I also provide consulting services. Currently, in fact, I'm working with an organization to help them create a clear strategy and plan to raise $3.5 million to expand their organization. So perhaps you're an executive director and you sense your organization has hit a lid on growth and you need a strategy as to how you can scale your nonprofit. Or perhaps the culture you set out to create is not the culture you have currently and it's impacting your staff retention. Or maybe you're facing a major resource challenge and you don't know what to do. That's where I can help. I come alongside leaders and organizations to create strategies to grow their organizations and maximize their impact. If your nonprofit needs help with fundraising, strategy, or operational effectiveness, reach out today. You can simply email me at rob@robharder.com. You can go to my website, robharder.com, or you can call me, 435-776-5173. I would be happy to provide a free sample coaching session or a consult to see how I can best be of help to you and your organization. Well, thanks again for listening. Now back to the show. Wow, there is so much here, which is wonderful. And it sounds like it's a very large scope when it comes to this overall project. Now, you've already talked a bit about the outcomes you hope to achieve. Do you have some results and insights already that perhaps you can give us a bit of a sneak peek, if you will, as to what you're already seeing as you're going about this project?
So we're hoping that the project gives us a sense of what the conversation even is right now. AI is just unraveling so quickly. Yeah. So we're just trying to keep a sense of like, well, what is the conversation and what are the things we need to be considering? Where are the trailblazer states in thinking about this? And then what can the other states learn from these trailblazer states? So right now, our data science team is starting to look through all of the data that we've collected and trying to see trends and figure out what we can analyze and what picture we're starting to get. We're starting to see that some states have information out there and other states do not, right? So there's a lot of variation, heterogeneity in what's already out there so far. So definitely stay tuned.
Wow, it's so fascinating to me. And I would like to see the contrast from your experience now using AI and studying AI and the impact of AI in the medical research sector with your research, but to compare it to how it was different in your days at University of Michigan, where you did research in a much different way. What were some of the big things that really have stood out so far when it comes to using AI and this research project?
So I would say the technology, right? It's like what you can do and you can do it faster and quicker in ways that, 10 years ago when I was in grad school, it would have taken you your whole career to do something that, can now be done in a few weeks. And, how do we use that to our advantage is the question. And then how do we also not cause harm in the process? Like, how do we not be too fast, but faster, right? So that's the big difference is it just makes everything just faster.
Wow, there's a lot of nonprofits dedicated to research, of course. So from your experience, why is this research so important? And what have you learned so far from this collaboration with the GE Healthcare Foundation? And how have they really facilitated or maybe been a catalyst for you being able to do this research project perhaps quicker and with more funding?
Yeah, well, we're so glad, again, for the support of GE Healthcare Foundation as we tackle this important and timely issue. And I specifically say important because we know the impact that this has on maternal health and how many women are affected in the U.S. That really shouldn't be, right? Because it's preventable, but also timely because AI, this is AI. This is a new AI era that's being ushered in. And we want to make sure that we do that right. And research itself is just so important because it equips policymakers and stakeholders and decision makers and physicians with evidence of what decisions to make, right? And so this project is just so critical at this moment when AI is just being developed so rapidly and on top of that, being layered on some of the cracks that already exist within American society, including our terrible rates of maternal morbidity, mortality, and infant mortality. So in public health, we have what we call the theory of fundamental causes. And one of the tenets of that theory is that whenever there's new technology, that always increases disparities because the haves get it, the haves don't. And what we're trying to do is we're trying to stay ahead of that curve this time. Like, okay, we know all of these new technologies come out, but if we can center equity at the foundation, at the beginning, then can we prevent that exacerbation that typically happens when new technologies are brought about? And, AI just has so much potential, but it has so much potential in both directions, right? It has potential to go really, really well. It can help with implicit biases of, physicians that currently cause racial health inequities and go the other way and, be really, really harmful because the data that is being used to develop these AI models, if that data itself is flawed, if that data itself is inequitable, then it's only going to be magnified when you put it into AI methods. So what we're trying to do is to take this moment, because this moment is so important, and make sure that we're baking equity into it at the ground level or as soon as we can and sound that trumpet now so that we don't have to try to fix it later.
I'm really glad you're bringing this up. I've had many people talk about nonprofits and AI specifically utilizing AI, say with fundraising, for example, or special events. And here's a really interesting application when it comes to medical research. I mean, you've already spoken to some of the exact concerns that I've talked to others about, the concern about privacy, the concern about bias built into AI itself, and as you say, the risk of exacerbating the issue. So I know it's early and you're still in the process of doing this research project, but so far, what would your verdict be? Is having AI an asset Or are there more liabilities right now utilizing AI? Or is it too early to say? What would you say to that?
I think it's too early to say, but history tells us that new technologies exacerbate. History tells us that it exacerbates. But I think it can go both ways. It's just which one is going to that's it. I think one of my concerns is that, people will say, oh, well, this is what the model showed me. And it's not my fault. The model did it. Right. So then it becomes who's responsible for what went in the model in the first place. And if the model is already being trained on inequitable data or data that's been incomplete, that gives us the results that we have now, then who do we even point to say, this is where we went wrong, right? Because now it's just the computer. The computer told me this. So it's just so critical. It's so critical for so many lives, really, literally lives at stake, that we get this right in this moment.
Okay, for my listeners then, what would you like them to take away from this work? Like if they're really get interested in what you're having to say and want to do their own research and learn more about the Urban Institute, what would you like them to take away from this work?
I think, just to keep being vigilant to make sure that equity is baked in at the ground level. Some states have developed plans, many have not, right? So some states are going to catch up and try to do it. This is just a foundational moment. And this is an opportunity to build equity into the fabric and policies that are being developed right now. And we have to realize the moment that we're in and make sure that it's the burden is on us of the America that we give to our kids in the next generation to make sure that we do this right. And secondly, I would say that this isn't a one and done project. I think that, obviously AI is here to stay. Obviously, the maternal health crisis has existed for a very long time. It's been pervasive. So to really do this and to really intervene and really get the outcomes that we really not only want, but really should have, that we've got to make sure that we're on top of this and that we're really paying attention and not just paying attention, but actually intervening when needed. So we need the morale and the will to actually to intervene on these issues.
Well, related to that, how can people connect with you if they want to connect with you or find out, again, more about the Urban Institute as a whole? Where would you send them?
Sure. So I'm on LinkedIn and X as Kristen Brown, PhD. Urban is on all social media platforms, X, Facebook, LinkedIn, YouTube, as Urban Institute. So we're not too hard to find.
Well, Dr. Brown, it's fascinating to hear what you're doing. And thanks for answering those questions about how you're utilizing AI, in this case, for medical research. And thanks again, just for sharing your insights and for taking time to be on the show.
Oh, thank you so much for having me. This was fun.
Hey, friends. Well, I wanted you to know that this podcast can be found on iTunes, Spotify, Amazon, Google Podcasts, and wherever you listen to other podcasts. I also want to encourage you to like, subscribe, and share this podcast with others. This will actually help us get this great content out to more nonprofit leaders just like you. You can also join the Nonprofit Leadership Podcast community. Find other resources and interviews of past guests all on my website, nonprofitleadershippodcast.org. Well, thanks again for listening. And until next time, keep making your world better. And don't forget to subscribe to my YouTube channel, the Nonprofit Leadership Podcast. Go to YouTube and look up Nonprofit Leadership Podcast. We'll see you there. This podcast is sponsored by DonorBox. DonorBox, helping you help others with the best donation forms in the business.